An advance directive is very important to have because this is the document that you'll be handing to your provider when you are in a difficult situation and you may have somebody needing to make decisions for you, but it's not the only thing that will determine your advanced care plan. There are other elements to this, like your proxy caretaker, a person that knows your wishes, that knows your spiritual beliefs, that knows your convictions. That person will also be involved in helping make these decisions when you find yourself in a difficult situation. So the University of South Dakota has a pretty long history of serving the state citizen, and we are in a unique position to look at rural citizens because we have campuses in Vermilion as well as in urban Sioux Falls and in more rural areas as well as in Rapid City and in Pierre. So USD nursing is spread throughout the state, and we have formed a coalition, a statewide coalition that is called the Advanced Care Planning Quality Conversations Coalition. That was formed in 2015, and that was very responsive to local needs. So we were approached by the Great Plains Quality Innovation Network at that time to come up with a strategy for introducing advanced care planning in South Dakota at the grassroots level. So we're working at the grassroots level there with many partners that include the state's major healthcare providers as well as local community centers and senior citizen centers, as well as nursing homes or activity centers. So we have a wide coalition of interests represented in that coalition. In 2016, we initially obtained a small grant from the South Dakota Community Foundation that helped us get started training advanced care planning trainers and facilitators, and that money was used to train students to train USD nursing students who then went out and taught workshops in Vermilion. At that point, we noticed that the program was well received. We reached more than 200 community members in just a single semester through our students who were trained through this program with help from the South Dakota Community Foundation. We used these preliminary results and went to the Bush Foundation, who then provided us with more money to spread the program statewide. So they asked us for some evidence whether the program would be acceptable to South Dakotans, and we said yes, we can tell you that South Dakotans are indeed very interested in advanced care planning because we have tried it, and that's how come they trusted us to spread the message statewide. And this is the stage that we're at now. We're trying to get the message across the entire state. So we're trying to be very inclusive and to include rural as well as urban populations. We're trying to spread the message that advanced care planning is a very important function in someone's life. We regard the advanced care planning process as a process rather than a one-time decision. We think that everybody in South Dakota at all ages above 18 should be thinking about advanced care planning, and we believe that the plan may change and should be adaptable throughout the lifetime. So we regard this as a process that, with the end result of increasing respect for a patient's wishes when a patient is faced with a tragic situation in which he or she cannot make their own decision anymore and relies on a caretaker or on a proxy caretaker to make decisions for him or her. So that's what we're trying to accomplish. We're trying to start conversations within families or within groups of friends about the wishes of an individual, so these wishes can be honored at the end of life, and so that caretakers can be informed about these wishes. And these may be medical personnel as well as nursing home personnel or staff at the ICU, the various kinds of medical care providers or other care providers that come into contact with an individual when that individual is no longer able to make decisions for him or herself.
An advance directive says what kind of care you want at the end of life, based upon, do you want CPR? Do you want to have a tube feeding? Do you want to have IV therapy? Do you want to have antibiotics? And it's spelling that out completely for your healthcare providers so that your wishes are received and initiated at the end of life. And those wishes change throughout your lifetime. So now, as being a young, healthy person, my wishes would be that I would want everything done to sustain my life right now. But if I received another diagnosis, such as a terminal cancer diagnosis, well, then my wishes would maybe change. And so then I would need to change my advance directive based upon that state that I am in my life. And so it's a never-ending process throughout the lifespan, so that whatever our wishes are, wherever we're at in our stage of life, that those wishes will be granted and will receive the care that we want to receive. And we do know that the majority of care and the majority of the money spent on our health care is spent in the last year of life. And many times that care is unwanted care because we had not shared what our wishes were with our family member or our provider. So everything is done. And we know that many people do not want everything done at the end of life. So, and it's all very individual based upon spiritual and social issues. And so we need to keep that in mind. And so having that communication with our family and our healthcare providers are very important. And so by training community members and nursing students to have those conversations with people, patients, and clients, it puts that seed in their mind, and so that to promote those conversations and to guide them in those decisions. So if anyone is interested in having facilitators come to their group or organization and have us present to them, we would be glad to do so. And as Sabina said, we have students across the state of South Dakota and community members that are trained. And so we have team members in Rapid City, in Pierre, in Sioux Falls, and also in Vermilion. And so we're able to go out into those communities and have these conversations and training sessions so that people are familiar with how to develop an advance directive and also how to share that advance directive with their healthcare provider. Because that is our end goal, is that the healthcare provider has that advanced care plan in their record so that their wishes are followed when the end of life time comes. And again, it's for all adults ages 18 years of age or older, because none of us ever know when that time will come. And by being prepared, it decreases the stress that goes on in that situation. And so if you're interested in having us come out to your community, I can share with you our telephone numbers. The nursing program in Sioux Falls number is 605-357-1570. In Vermilion, you can call 605-658-5611. Or you can also notify us per email, and our email address is nursing@usd.edu. And we would love to be able to come out to your community and share this information